just about all of his 98 years, Carl Reiner made people laugh. He died this past Monday. Tributes have been pouring in all week, which brings us to this one from our Mo Rocca.
First thing in the morning, before I have coffee, I read the obits.
Seriously?
Yes, if I'm not in it, I'll have breakfast.
Even when discussing something grim,
I think about how I'd like to go. What a show this would be if I was talking to you.
Carl Reiner, who died last week at 98, couldn't help but sound sunny.
He was rare in that I can't remember him being in a bad mood or him telling me about a bad mood.
Legendary TV writer and producer Norman Lear, now 97, was close friends with Reiner for more than 50 years.
This may be a little hokey, but what do you think kept him going so long?
The same thing that keeps me going so long. We both like getting up in the morning. And he missed it today. He missed it today.
Carl Reiner didn't miss a lot. One of television comedy's founding fathers, Reiner first came into our homes as a featured player on Your Show of Shows.
There is one thing I've learned being superintendent of this hospital for the last 16 years. It's this, that this is a hospital and not an experimental laboratory.
On Your Show of Shows, he was the second banana to Sid Caesar.
I understand that Hughes is a reporter. Look, boy, we don't like reporters.
What made him so good in that role?
Carl had no need to be the principal in anything. A lot of comics do. And so he could be very funny as a sidekick and a straight man.
The Dick Van Dyke Show.
Reiner is probably best known for creating The Dick Van Dyke Show, which began airing on CBS in 1961. It starred Dick Van Dyke as the head writer of a fictional TV program.
He's the head writer of the Alan Brady Show.
Oh, sure. Is that still on?
Reiner played the blowhard host.
Hi there, remember me?
Right. A mensch, the greatest human being I ever met in my life. Unique, irreplaceable man. For some reason, Carl had a deep
Hello, everyone. I have something to ask you. Will you add your name to join my campaign? We still have a long way to go to cancel it. And that makes me personally very unhappy, but that is where we are. On the COVID transmission, following the facts are changing as they learn more about this virus. There's less concern about surface area transmission, more data that it is primarily an airborne transmission. That then raises the question of what can we do with air filtration technology? You hear this is an air-conditioned building. It's bringing air up into the HVAC system. It then runs through the HVAC system and gets recirculated. What kind of filtration can you have on the HVAC system that may be capable of catching the virus as it's attached to the droplets? There are filters that systems install. HEPA filters are one of them, and then a series of filters that are rated by the minimum efficiency reporting value, MERV value. And the most dense filters can actually filter out the virus, which is remarkable and interesting. Nothing is simple with this virus. It depends on the air conditioning system you have, whether or not it can take one of these higher filters and still operate. And different systems take different filters, and we're working through that now. We're spending time on it because I think there's a real possibility that we could actually have a positive contribution here. And different HVAC systems have different capacities, but we're working through this now. Because if there is a way to filter the air, and there's a way to get COVID out of the air, then we want to do that. And if we can do that without an exorbitant expense for existing HVAC systems, it's something we have to look at. So we're in the midst of that now, and as soon as we know something, we will make it public. New Yorkers did the impossible. We went from the worst infection rate in the United States to the best infection rate in the United States. I like to say that we crossed the mountain. There's the mountain. We don't want to have the challenge of crossing a mountain range, right? One mountain was enough. The last thing we need is to see this virus spike again. And there are two threats in that area. One, New Yorkers getting complacent. This is great. New York's doing great. The numbers are down. I heard the governor. He said everything is great. We get complacent. We get cocky. We get a little arrogant. That is a real threat, and it's a threat that I'm concerned about. You look at the festivities over July 4th, you see gatherings that are not socially distanced. They're not wearing masks. You see it in Manhattan. You see it on Fire Island. There are reports upstate of gatherings where people aren't socially distanced and people aren't wearing masks. You know, I don't know how else to say it. Actions have consequences. Our success was a function of our action. You change your action, you change your behavior, you're going to change the outcome. It is that simple. That curve was purely a function of what we did. If we change what we're doing, you're going to change the trajectory of the virus. I understand people are fatigued. We've been doing this for 128 days. I get it. But it doesn't change the facts. And we have to stay smart. We need, every person in the state needs the local governments to enforce the law. And I talk to local governments about this all the time, mayors, county executives, etc. And I'm going to have another round of conversations today. I understand that it is not politically pleasant to enforce the mask law or the gathering law or the socially distanced law. I get it. I get that politically it's difficult for the local governments to do it. But it is the law. And if we don't do it, there's going to be a serious problem. It's not a local government law, it's a state law. So I get the politics, and I've said to them, I have no problem taking responsibility. Mr. Mayor, tell your police when they go out to enforce the law, they can say, don't blame the mayor, it's the governor. Blame Governor Cuomo. County executive, tell your police, don't, when they hand out a summons, say, this is not a county law, it's a state law. Blame the governor. I don't have a problem with that. But they have to enforce the law. We do not have a state police department that is large enough to enforce the law in the entire state of New York. That's why we have local police agencies. But they have to do their job and they have to enforce the law, and the law is clear. And I don't want to be difficult or unnecessarily difficult, but I'm telling you, if we don't follow these behaviors, the numbers are going to go up. It's that simple. The second threat is you now have 38 states in this country with an increasing virus rate of infection. It's only getting worse. It's not getting better. You look at states like Texas, you look at Arizona, you look at those curves. I mean, we know those curves. We've seen them. We've been there, done that. This is a frightening situation across this country. Look at California. Look at the curve on California. We've been here. We've seen this. Deja vu all over again. A.J. Parkinson said that. No? Will Rogers said that. Just see if you're paying attention. I know it's a Monday morning, you're a little sleepy. Will Rogers did not say it. Yogi Berra said it. 2 points. But it's deja vu all over again. This is how the virus came to New York in the first place. It got on a plane in Europe, and it landed at JFK and Newark, and that's why we had the spike. Nobody knew it at the time. Everybody was saying China virus. The China virus had gotten on a plane, went to Europe, and then it came here from Europe. 3 million people got on planes, landed in New York, January, February, March. That's how we had the problem we had. Now, you're going to see people getting on planes from the 38 states in this nation where the virus is going up. They're now going to land at JFK, Newark, etc. You know, an outbreak anywhere is an outbreak everywhere. That's the new mentality we have to have. We can't protect ourselves as an island because we're not. We have people coming in and out all day long. And when you have these spikes in China, in Europe, that's how it happened the first time. Now people can come from Florida, anywhere else. We're already seeing it. We have had significant clusters where people came from out of state. They came in, they attended a function, bang, the next day we have an increase in the infections. We're doing so many tests and so many tracings that we can trace it back to patient 0, and they're very often from out of state. We have it downstate, we have it upstate. It is inevitable. So yes, New Yorkers have to be smart, but we also have a problem that if the virus is increasing anywhere, it's going to travel here, and then we're going to have a problem. denying COVID is really advancing the COVID virus. And I know this is a politically charged environment right now, and somehow COVID has become a political issue, which I've never heard of a virus becoming political, but in this environment it has. But if you deny the problem, then you will never solve it. We're not the United States of denial. We have never been a nation that has excelled because we refuse to admit the problem. We admit the problem, and then we overcome the problem. If we do not, as a nation, acknowledge the COVID viral increase, it is going to continue. Those upward numbers don't change on their own. They only change when you change them. That number keeps going up unless you bend the curve. The bend doesn't happen naturally. The bend happens when people change their behavior and actually reduce the transmission rate. So you look at those numbers in those states, those upticks are just going to continue. That mountain, that didn't just plateau because God said plateau. It plateaued because we did masks and social distancing and close down and all those activities and testing and tracing. That's how we bent the curve. If we are in a state of denial, you're going to see that curve continue to go up. Now, how do you bend the curve? We know how to bend the curve because we did it. You have to be aware of it. You have to admit it. You then have to take action, and you have to be committed to it. And it starts at the top with leadership. The President said over this weekend, if we didn't test so much and so successfully, we would have very few cases. Okay? Think about that for a second. What he's really saying is, if we didn't test, we wouldn't find the cases, and if we didn't find the cases, we wouldn't have a problem. That's incredible, but that's what he is saying. Okay, so let's just extend that logic. If we don't test, then we won't know, and if you don't know, then you have no problem. It's a great way to go through life, isn't it? So on that theory, let's do no more cancer tests, and that'll solve the problem with cancer. No more mammograms, because we don't want to know, and that'll solve breast cancer. No more prostate checks, that'll solve prostate cancer. No more TB checks, that'll end TB. No more HIV tests, and that will solve the AIDS issue. No, not knowing doesn't mean you don't have a problem. And in this case, if you do not admit it, and if you don't confront it, it is only going to increase. We know it has to be done because we lived it here and we did it here. To bend the curve, yes, you have to test, yes, you have to trace, yes, you have to isolate, yes, you have to phase the reopening, and you have to socially distance. But by the way, phasing the reopening is better than reopening recklessly, where you have the states, okay, we're reopened, everybody comes out, the virus goes up, stock market goes down, and now the states are saying we have to close again. A phased reopening is better than reopening and closing. That is not just a premise, it's been proven by the past experience. Look at the states that reopened recklessly and are now closing again. Who did that help? It actually set us back. So, Mr. President, don't be a co-conspirator of COVID. Do one simple thing. Acknowledge to the American people that COVID exists. It is a major problem.
It's going to continue until we admit it and each of us stands up to do our part. If he does not acknowledge that, then he is facilitating the virus. He is enabling the virus. How did this become a political statement? This is common sense. And let the president start by sending that signal very simply. Just wear the mask. I've been asking him to do it for weeks. Just wear the mask and say to the American people, this is real and it's a problem and we have to do our part. We started masks April 15th. First state in the nation to start masks. They make a difference. July 4th, true patriots wear masks. True patriots are New York tough and smart and united and disciplined and loving.
Governor, one other thing the president has said in recent days is that the virus is no longer as lethal as it was when it targeted New York. He's made the case that 99.9% of the people who get it are fine and that you basically just need to live with it. I wonder what your response is.
Yeah, I know this is what the president says. The president says a lot of things, right? They're not necessarily facts. They're not necessarily true. 99.9%. They then had his FDA commissioner on the television and said, is the president right? And he wouldn't say the president is right. He makes up facts. He makes up science. He wants to deny the COVID virus. He has from day one. Well, it's just like the flu. Well, it's going to be gone by Easter. It's going to get warm and then it's going to disappear like a miracle. He said all those things. None of them were true. And now we have a problem in 38 states because some people believed him. He won't wear a mask. Vice President Pence says wear a mask. All the health officials say wear the mask. He won't wear a mask because he doesn't want to admit that there is a COVID virus. Why? I have no idea. But his denial of the problem and his making statements like that, 99.9% don't have to worry about it. Okay, then there's no issue. What he's saying to the American people is there's no problem. And then they don't wear a mask, and they don't socially distance, and they don't take any precautionary behavior, and then the virus goes like this. He is facilitating the virus. He is enabling the virus by statements like that. But this is great news. The rolling average for number of lives lost is 9 yesterday. We did 54,000 tests yesterday. On average, we do about 60,000 tests per day. It's the highest testing rate in the nation. 0.95 positive. We normally run about 1.2, somewhere in that range. So that's all good. So what does this mean? What it means is, since we started reopening, which was May 15th, we started our phased reopenings. The numbers have actually declined since we started reopening. Okay, you see that gold line under May 15th. That's where we were when we started reopening. Every expert warned us on the reopening that you could see the numbers start to go up, right? Because you were increasing activity. Our premise was you could moderate the activity, so you could start the reopening, but monitor the number of cases and control the phased reopening to keep the number of cases down. And that's just what we've done for the past 7 weeks. So we're actually down from where we were when we started reopening, which, as you remember, no one predicted. The question was, when you start reopening, activity will go up, number of cases will go up. Can you control the increase? That was the question. we haven't needed to control the increase. We've actually had a slight decline, and now we're basically running flat. And that is great news. That is really great news. And it's what we said from day one with my great graphic that nobody liked at the time I originally did it, and nobody still likes, but I like it. So sometimes it's nice to be governor. You have a valve. Control the activity and monitor the valves to see if the infection rate is going up, the hospitalization rate is going up, and keep your hand on the valve. And you see it start to go up, slow down the valve. If you don't see the numbers going up, then you can open up the economic activity valve. And that's what we've been doing. And that's what you see with these little corrections. So New York City goes into phase 3, but no indoor dining, right? So we have the phases, and then we have certain adjustments that we make to the phases. But the numbers show you that we are right where we want to be. New York City goes into phase 3 today, no indoor dining, but there are rules on phase 3, right? It doesn't mean go out and have a party. We have 50% occupancy for personal care services. You have to wear face coverings. Customer wear face coverings, 6-foot distance. Prohibited services that require removal of face coverings, such as facials. You can't get a facial. I did that against my own self-interest. I was supposed to get a facial today. Close the waiting rooms. Employees providing services must be tested every 14 days. So there are rules. Tomorrow is phase 4 for Westchester, Rockland, Hudson Valley. Long Island is on track for phase 4 on Wednesday. Their numbers are all good. School reopenings, just to make sure there's no confusion. There are 700 school districts in the state. The state has directed all 700 school districts to come up with a plan on how they would reopen, because there's 2 levels of discussion. Should they reopen? And then if they reopen, what does a reopened school look like in the quote-unquote new normal, right? So we've asked every school district to come up with a plan on what reopening would look like in your district. New York City is coming up with a plan pursuant to that request on what it would look like to reopen the New York City school system in September. But there has been no decision yet as to whether or not we are reopening schools. We obviously very much would like to. Nobody even knows the effect that this is going to have on students, socialization of young students, etc. We want kids back in school for a number of reasons, but we're not going to say children should go back to school until we know it's safe, right? And we have some time. This is a very fluid situation. When we get the data, we will make a decision. In the meantime, I'm telling all school districts to come up with a reopening plan. But we don't yet know if we are going to reopen. And we'll follow the data and we'll make a decision on the data. The Department of Health is also working on this. So every school district is coming up with a plan to reopen. That doesn't mean they are reopening, okay? Nuance sometimes is important. Not often, but sometimes it is. On casinos, movie theaters, we're still looking at the data, but for now they're going to be closed. We are not going to open the state fair in Syracuse. This is a really tough one. Fairs all across the nation are not reopening. We have a fantastic state fair in Syracuse. We've invested a lot of money. We've had record attendance, 1.3 million people last year. We broke the attendance record. We invested money. We redid the whole state fair. We built a new expo center, 110,000 feet. It's really amazing. And it's been an economic boom for the whole region. But this year we're going to have to cancel it. And that makes me personally very unhappy, but that is where we are. On the COVID transmission, following the facts. The facts are changing as they learn more about this virus. There's less concern about surface area transmission, more data that it is primarily an airborne transmission. That then raises the question of what can we do with air filtration technology. You hear this is an air-conditioned building. It's bringing air up into the HVAC system. It then runs through the HVAC system and gets recirculated. What kind of filtration can you have on the HVAC system that may be capable of catching the virus as it's attached to the droplets? There are filters that systems install. HEPA filters are one of them, and then a series of filters that are rated by the minimum efficiency reporting value, MERV value. And the most dense filters can actually filter out the virus, which is remarkable and interesting. Nothing is simple with this virus. It depends on the air conditioning system you have, whether or not it can take one of these higher filters and still operate. And different systems take different filters, and we're working through that now. We're spending time on it because I think there's a real possibility that we could actually have a positive contribution here. And different HVAC systems have different capacities, but we're working through this now. Because if there is a way to filter the air, and there's a way to get COVID out of the air, then we want to do that. And if we can do that without an exorbitant expense for existing HVAC systems, it's something we have to look at. So we're in the midst of that now, and as soon as we know something, we will make it public. New Yorkers did the impossible. We went from the worst infection rate in the United States to the best infection rate in the United States. I like to say that we crossed the mountain. There's the mountain. We don't want to have the challenge of crossing a mountain range, right? One mountain was enough. The last thing we need is to see this virus spike again. And there are two threats in that area. One, New Yorkers getting complacent. This is great. New York's doing great. The numbers are down. I heard the governor. He said everything is great. We get complacent. We get cocky. We get a little arrogant. That is a real threat, and it's a threat that I'm concerned about. You look at the festivities over July 4th, you see gatherings that are not socially distanced. They're not wearing masks. You see it in Manhattan. You see it on Fire Island. There are reports upstate of gatherings where people aren't socially distanced and people aren't wearing masks. You know, I don't know how else to say it. Actions have consequences. Our success was a function of our action. You change your action, you change your behavior, you're going to change the outcome. It is that simple. That curve was purely a function of what we did. If we change what we're doing, you're going to change the trajectory of the virus. I understand people are fatigued. We've been doing this for 128 days. I get it. But it doesn't change the facts. And we have to stay smart. We need, every person in the state needs the local governments to enforce the law. And I talk to local governments about this all the time. Mayors, county executives, etc. And I'm going to have another round of conversations today. I understand that it is not politically pleasant to enforce the mask law or the gathering law or the socially distanced law. I get it. I get that politically it's difficult for the local governments to do it. But it is the law. And if we don't do it, there's going to be a serious problem. It's not a local government law, it's a state law. So I get the politics, and I've said to them, I have no problem taking responsibility. Mr. Mayor, tell your police when they go out to enforce the law, they can say, don't blame the mayor, it's the governor. Blame Governor Cuomo. County executive, tell your police, don't, when they hand out a summons, say, this is not a county law, it's a state law. Blame the governor. I don't have a problem with that. But they have to enforce the law. We do not have a state police department that is large enough to enforce the law in the entire state of New York. That's why we have local police agencies. But they have to do their job, and they have to enforce the law, and the law is clear. And I don't want to be difficult or unnecessarily difficult, but I'm telling you, if we don't follow these behaviors, the numbers are going to go up. It's that simple. The second threat is you now have 38 states in this country with an increasing virus rate of infection. It's only getting worse. It's not getting better. You look at states like Texas, you look at Arizona, you look at those curves. I mean, we know those curves. We've seen them. We've been there, done that. This is a frightening situation across this country. Look at California. Look at the curve on California. We've been here. We've seen this. Deja vu all over again. A.J. Parkinson said that. No? Will Rogers said that. Just see if you're paying attention. I know it's a Monday morning, you're a little sleepy. Will Rogers did not say it. Yogi Berra said it. 2 points. But it's deja vu all over again. This is how the virus came to New York in the first place. It got on a plane in Europe, and it landed at JFK and Newark, and that's why we had the spike. Nobody knew it at the time. Everybody was saying China virus. The China virus had gotten on a plane, went to Europe, and then it came here from Europe. 3 million people got on planes, landed in New York, January, February, March. That's how we had the problem we had. Now, you're going to see people getting on planes from the 38 states in this nation where the virus is going up. They're now going to land at JFK, Newark, etc. You know, an outbreak anywhere is an outbreak everywhere. That's the new mentality we have to have. We can't protect ourselves as an island because we're not. We have people coming in and out all day long. And when you have these spikes in China, in Europe, that's how it happened the first time. Now people can come from Florida, anywhere else. We're already seeing it. We have had significant clusters where people came from out of state. They came in, they attended a function, bang, the next day we have an increase in the infections. We're doing so many tests and so many tracings that we can trace it back to patient 0, and they're very often from out of state. We have it downstate, we have it upstate. It is inevitable. So yes, New Yorkers have to be smart, but we also have a problem that if the virus is increasing anywhere, it's going to travel here, and then we're going to have a problem. Denying COVID is really advancing the COVID virus. And I know this is a politically charged environment right now, and somehow COVID has become a political issue, which I've never heard of a virus becoming political, but in this environment it has. But if you deny the problem, then you will never solve it. We're not the United States of denial. We have never been a nation that has excelled because we refuse to admit the problem. We admit the problem, and then we overcome the problem. If we do not, as a nation, acknowledge the COVID viral increase, it is going to continue. Those upward numbers don't change on their own. They only change when you change them. That number keeps going up unless you bend the curve. The bend doesn't happen naturally. The bend happens when people change their behavior and actually reduce the transmission rate. So you look at those numbers in those states, those upticks are just going to continue. That mountain, that didn't just plateau because God said plateau. It plateaued because we did masks and social distancing and close down and all those activities and testing and tracing. That's how we bent the curve. If we are in a state of denial, you're going to see that curve continue to go up. Now, how do you bend the curve? We know how to bend the curve because we did it. You have to be aware of it. You have to admit it. You then have to take action, and you have to be committed to it. And it starts at the top with leadership. The President said over this weekend, if we didn't test so much and so successfully, we would have very few cases. Okay? Think about that for a second. What he's really saying is, if we didn't test, we wouldn't find the cases, and if we didn't find the cases, we wouldn't have a problem. That's incredible, but that's what he is saying. Okay, so let's just extend that logic. If we don't test, then we won't know, and if you don't know, then you have no problem. It's a great way to go through life, isn't it? So on that theory, let's do no more cancer tests, and that'll solve the problem with cancer. No more mammograms, because we don't want to know, and that'll solve breast cancer. No more prostate checks, that'll solve prostate cancer. No more TB checks, that'll end TB. No more HIV tests, and that will solve the AIDS issue. No, not knowing doesn't mean you don't have a problem. And in this case, if you do not admit it, and if you don't confront it, it is only going to increase. We know it has to be done because we lived it here and we did it here. To bend the curve, yes, you have to test, yes, you have to trace, yes, you have to isolate, yes, you have to phase the reopening, and you have to socially distance. But by the way, phasing the reopening is better than reopening recklessly, where you have the states, okay, we're reopened, everybody comes out, the virus goes up, stock market goes down, and now the states are saying we have to close again. A phased reopening is better than reopening and closing. That is not just a premise, it's been proven by the past experience. Look at the states that reopened recklessly and are now closing again. Who did that help? It actually set us back. So, Mr. President, don't be a co-conspirator of COVID. Do one simple thing. Acknowledge to the American people that COVID exists. It is a major problem. It's going to continue until we admit it and each of us stands up to do our part. If he does not acknowledge that, then he is facilitating the virus. He is enabling the virus. How did this become a political statement? This is common sense. And let the president start by sending that signal very simply. Just wear the mask. I've been asking him to do it for weeks. Just wear the mask and say to the American people, this is real and it's a problem and we have to do our part. We started masks April 15th. First state in the nation to start masks. They make a difference. July 4th, true patriots wear masks. True patriots are New York tough and smart and united and disciplined and loving.
Governor, one other thing the president has said in recent days is that the virus is no longer as lethal as it was when it targeted New York. He's made the case that 99.9% of the people who get it are fine and that you basically just need to live with it. I wonder what your response is.
Yeah, I know this is what the president says. The president says a lot of things, right? They're not necessarily facts. They're not necessarily true. 99.9%. They then had his FDA commissioner on the television and said, is the president right? And he wouldn't say the president is right. He makes up facts. He makes up science. He wants to deny the COVID virus. He has from day one. Well, it's just like the flu. Well, it's going to be gone by Easter. It's going to get warm and then it's going to disappear like a miracle. He said all those things. None of them were true. And now we have a problem in 38 states because some people believed him. He won't wear a mask. Vice President Pence says wear a mask. All the health officials say wear the mask. He won't wear a mask because he doesn't want to admit that there is a COVID virus. Why? I have no idea. But his denial of the problem and his making statements like that, 99.9% don't have to worry about it. Okay, then there's no issue. What he's saying to the American people is there's no problem. And then they don't wear a mask, and they don't socially distance, and they don't take any precautionary behavior, and then the virus goes like this. He is facilitating the virus. He is enabling the virus by statements like that. And you're seeing the infection rate go up, and you're seeing the economy suffer, and he is part of that current debacle that we are in. Look at New York. We know what to do because we did it. We did it. We know there's a model that says you can contain the virus. We did it. And by the way, we did it in the worst case scenario. That's what's really breathtaking here. We didn't have 7 cases. We had the highest infection rate in the country. We had the highest infection rate per capita on the globe through no fault of our own. Frankly, because the federal government didn't know what it was talking about when it said the virus was in China. They needed a map because the virus was in Europe and it came here from Europe. But we know what to do. But the first step is you have to admit the problem. You will never solve a problem in life that you refuse to admit. Why he refuses to admit it, I have no idea. You have a White House coronavirus task force. Why do you have a task force if there's no problem? Right? 99.9%. It's just made up.
Governor, if I could ask you about this DOH report regarding specifically nursing homes. It concludes that the data shows that staff and visitors inadvertently brought the virus into these homes. But visitors were barred from going into them. So does that mean primarily it was the staff who spread it?
Visitors were not initially barred. Visitors were barred about middle of March. And by that time, the virus was in the nursing homes. We never tested visitors. At that time, we weren't testing anybody, right? Testing was just starting. But we didn't test visitors. And if you look at when the visitors were allowed in, they were allowed in up until about mid-March. The spike in the nursing homes was like 7 days, 14 days after that. So what the report was saying, between the family coming in and the staff, they were the transporters of the virus. Which we all knew from day one. We knew that nursing homes were the most vulnerable place. I made the decision to ban the visitors in mid-March, which I tell you was a very difficult decision, and a lot of people opposed it, and I understand why. But that's why we put in the ban, because if it is in the population and visitors and relatives are going into the nursing home, they were going to bring it in with them. And I was very uncomfortable having people in nursing homes who couldn't even see their loved ones. You know, you have a grandmother in a nursing home, a mother in a nursing home, you have to FaceTime your mother. I mean, but yeah, that's what it's saying. But if you look at, this is pre-ban. Staff, obviously, we never banned, but it's pre-ban of family and visitors. Do you want to make a point?
DOH consulted with a number of health professionals while they were doing the look back report, primarily with Mount Sinai, who was participating today at the press conference. And Mount Sinai put out a study that the New York Times actually covered last week, that they now have evidence of antibodies going back to the first week of February. So for the entire month of February, while we were relying on the CDC, because CDC was then doing all of the testing, and CDC was doing the testing and reporting to us and saying, we've tested people, New York has no COVID positive cases, and in turn, DOH was telling people of New York we have no COVID positive cases. For the entire month of February, we now know that COVID was existent in New York City. So DOH report actually says they can't conclusively say on visitors, but they have to assume that because it was within the general population, that it was walking through the front door into the nursing homes, again, through no fault of their own, and staff as well. It was February and March, and we now know asymptomatic people can give the virus to other people. So how would they have known? These are healthcare professionals. They would never do anything to intentionally hurt anybody else, but that's the conclusion. And most importantly, when you look at the timeline, we now know that from date of infection to death, it's approximately 18 to 25 days. So when you look at when the mortality took place, when people were dying in nursing homes, it began in the end of March and continued through, and its spike was the first week of April. So when you back out the dates on that, people were obviously giving it to people beginning at the end of February, beginning of March.
Yeah, let me just to put in perspective. Nobody knew what they were talking about for a long time. That's the bottom line here. And the federal government was just plain wrong. We had our first case March 1. They now say the virus was coming here January and February. And it came from Europe. And we had tens of thousands of cases because the antibody test now shows you had people back in February. So by the time we had our first case, March 1, it was already here. It had been here for weeks, if not months. And it was totally undetected. I mean, nobody had an idea. Second, they said asymptomatic people could not spread it. Remember that? We lived with that truth for a long time. Now they say, whoops, that was wrong. Asymptomatic people can spread it. So you didn't even have any symptoms. You didn't even think you had a bug or a virus or anything. You didn't even think you had a cold. You had no symptoms. And you went and visited your relative in a nursing home, January, February, up to mid-March. We do the family ban March 15th, let's say. We had our first case March 1. We did the family ban 2 weeks after the first case. And people were saying to me, why are you doing this so abruptly, so quickly? We did the ban within 2 weeks. Sounded fast, right? From first case to ban 2 weeks? No. The virus was here February, the virus was here January. And there was asymptomatic spread, which means you could have walked into a nursing home, been totally conscientious, had no signs of anything, and walked it into a nursing home.
So patients were coming back from hospitals, and they were not the main driver here of the actual spread. Then I'm just curious, why did you change the policy?
Which policy?
Which is that patients who went to hospitals for treatment were initially put back into homes. At some point, that policy changed.
I don't know when it changed.
So no, what you're talking about, Zach, is on May 10th, we did a couple of things. We then had increased testing capacity, and so we mandated that nursing homes do testing twice weekly of staff, which we had in place for about a month, and then we scaled back to once a week for regions of the state that were in phase 1. And then we had also said at the time that hospitals could not release nursing home patients unless they tested twice negative. And at that point, there wasn't as much stress on the hospitals because the number of hospitalizations and beds went down. We still didn't know then what we know now. And so at that point, obviously, it was a recognition that the nursing home population was very vulnerable. There were more beds, and so we said, out of an abundance of caution, you need to test negative before you're released. But even now we know, which is reflected in the report, which was confirmed by the medical professionals, is that after a certain number of days, you're no longer shedding the virus. So even if you're still positive after about 9 days, you're no longer able to give the virus to somebody else. But that was something that was done out of an abundance of caution.
Oh, look, what it was they were playing, look, I get politics, right? And I get the political environment, and I get the ugliness of politics better than most. And you had this political conspiracy theory that the deaths in nursing homes were preventable. And by the way, most of the deaths were in Democratic states, which was right, because that's the state that had the most COVID cases. And it was this policy that said COVID positive people couldn't be discriminated against by a nursing home. It has no basis in fact. It was pure politics, and it was ugly politics. And now the report has the facts, and the facts tell the exact opposite story.
So given the facts from this report, what, in your opinion, went wrong, and what could have, looking back, right, in hindsight, what could have the state, the federal government, and nursing homes done
Total hindsight, CDC, when they saw the virus, Luis, in China last December, should have taken out the big CDC whistle and gone as loud as they could. Last December. When they saw it this past January, they should have kept blowing the whistle. The CDC, all of them. When the Peter Navarro sent the memo to the president in January about the coronavirus, he should have done something. When the White House did the memo on possibly 2 million Americans infected, they should have done something. They should have said the virus was here when it was here. They should have said the virus was in Europe when it was in Europe. Then they should have said it was here when it was here. And that should have happened in January. March 1, it was over in March 1. It was over. We get our first case March 1. It was over. There were tens of thousands of people in New York, tens of thousands of infections, just waiting to manifest themselves.
Do you think the state government could have done anything differently, or do you think nursing homes could have done anything differently?
State government, I don't do global pandemics. I don't have an international health department. I don't trace China. It's not what I do. I don't trace Europe infections. It's not what I do. It's what the federal government does. You know, federal responsibilities, state responsibilities. I don't do international health monitoring. That was their job. What else could the nursing homes have done? If this nation had testing capacity, which we did not exist, and if we knew the virus was here as early as we knew, start testing last January every nursing home employee. And by the way, start testing every healthcare employee. Now, that is hundreds of thousands of tests, and you had no testing capacity. So you would have needed to know the virus was here, and you would have actually had to have a testing capacity, neither of which happened, right?
Governor, are you concerned with the rising number of shootings in the city, given what's happening with the police department?
Yes, very concerned.
Have you spoken to the mayor at all, or?
The state police are working on it. They're speaking to the NYPD police. My criminal justice people are going to be speaking with the mayor's criminal justice people. I'm going to be speaking with the district attorneys. I'm going to be speaking with the chief judge today. I'm very concerned about it. I'm concerned about it not just for the immediate loss of life, which is horrific. And again, it's the communities that in many ways need the most, pay the highest price. Many of these shootings, Brooklyn, Bronx, communities that are suffering through COVID, suffering inequality all across the board. So it is in and of itself, it's frightening and it's tragic and it's unnecessary. You know, COVID takes lives. You do everything you can to save a life. We can do better than this. We must do better than this. I'm also concerned for the city. We have the COVID that we're dealing with. A lot of people moved out of the city during COVID. You have businesses that can't fully reopen. That has an economic problem for the city. You then have to get restaurants up and running. You have to get concert halls up and running. You know, what makes New York City, New York City? The arts, the culture. When can you do that? Well, we don't know. And then you add on top of that a public safety concern. That is a bad combination of events and a bad combination of facts. So yes, I'm very concerned.
Governor, good government groups and some state lawmakers have said, given the state's progress in battling the pandemic, that the time has come to undo the state of emergency and your emergency powers, to which some of your staff members, your top staffers have said, given the danger at the national level, that is too soon. What are the benchmarks you think are appropriate for eventually ending the state of emergency and your own emergency powers before April 2021?
A state of emergency first exists federally, right? Federal government, which is government in denial, they've declared a federal emergency. There is no thinking American who doesn't believe this is a state of emergency. I don't believe there's any governor who's had their emergency powers revoked in the middle of an emergency. To tell you how stupid an idea that is, frankly, if the emergency powers, and stupid is a strong word, but sometimes it's just stupid. If the executive orders go away, you know what that means? You don't have to wear a mask. You don't have to socially distance. All businesses automatically reopen. Every business, movie theaters, Broadway, everything automatically reopens. Hospitals don't have to take people who have COVID unless they can pay. Everything that we have done that has worked goes away immediately because they were all done by executive order. So it's a stupid idea. Plus, it's an unnecessarily stupid idea because the way the law works, the legislature already has the power to unilaterally end any specific executive order. So let's say the legislature doesn't like the mask law. Fine. Then you pass a bill that says we're denying the mask law. They just do it as a legislature. I don't have to sign it, and the mask law is gone. So they always have that power. They haven't done it because, first of all, I talked to the leaders about the laws that we're doing, and the measures have all worked very well. New York is a national model for how we handled this pandemic as a society. So, yeah.
Governor, so are you assuming that the state of emergency would last through April 2021?
No. When does the federal? I hope it's off tomorrow. Tell me when the emergency ends. When does COVID end?
Vaccine in January and 0 deaths for 2 weeks nationwide.
When COVID ends, the emergency ends, right? Or when we get control of COVID, it ends. Do you think it ends today when you have 38 states with the viral spike increasing? Do you think now is the time to say no more masks? No. You had a point?
I was just going to say, gratuitously, I think it's so incredibly ignorant, and the idea that these good government groups who, I don't know what their area of expertise is, but I can tell you it's not global pandemic, and some of these lawmakers who I think are being just completely political, the last 128 days could not have gone the way that they did had the governor not had the executive authority. It would have been complete and total anarchy. There were large periods of time during this crisis when the thought of trying to get the legislature back to Albany to pass some of these laws, and also you guys watch every single day, you cover us. Sometimes these things get caught up and it's so incredibly difficult and time consuming. If we didn't have the expediency to be able to close down the businesses when we did, to mandate the masks when we did, for the governor to be able to do the things he needed to do, so many more lives would have been lost, and this is just a continuation of playing politics. And if they can't see that, then they aren't looking at the front page of the newspaper or turning on the news, because what's going on around the country could very easily end up right back in our own backyard, and then what? So I urge them to stick to their day job.
And the reason why it's stupid is the legislature is convened, and we've passed a lot of bills, and they didn't want to roll back any executive order. If they did, they would have, right? And I love that good government. You know who doesn't like the executive orders? The insurance companies don't like that they have to pay. And we've mandated they have to pay for tests, etc. There are some laws that limit liability, which tort lawyers don't like, because it could theoretically limit the number of lawsuits. Some members of the hospital community don't like it, because we have mandated that we share beds so everybody could have a bed. So I get it. I've taken the political heat. That's why I get paid the big bucks. I get it. But, you know, the groups, you don't just get to proclaim yourself a good government group, you know. It's not by just a proclamation. I declare myself a good government group. I've been asking them for years, who pays you? Who pays you? Where do you get your money from? Who pays your salary? They won't say. Isn't the essence of good government transparency, disclosure? Are you getting paid by the insurance companies who don't want to pay for the COVID testing? Do you take money from the trial lawyers who want to be able to sue people? I'm just wondering, who pays your salary, right? They won't reveal their donors. Why not? Oh, it'll be a breach of security. We may be targeted for death. Come on. When you don't want to answer questions, there's normally a reason.
On the topic of gun violence in the city, Commissioner Dermot Shea says it's because too many people are being released from jail and back on the street too soon, and that needs to change. Do you agree?
Nope. Nope. We changed bail. We reformed bail reform, right? We did that. That's what they said months ago when there was a spike in crime. Well, it was the bail reform law, right? That was the first spike. They blamed it on bail reform and said we have to reform bail reform. We came back, we reformed bail reform. The mayor praised the reform of bail reform. So we did that. That happened. Those concerns were addressed. The chokehold law, which was also mentioned, that law embodied existing NYPD policy. So it can't be the chokehold law either. Well, the courts aren't processing people. That's not true either. So,
The major crimes unit, though, that definitely made a change. The disbanding of the major crimes unit?
by who?
by the NYPD. They
Well-
disbanded, the mayor de Blasio disbanded.
Well, that's what I'm saying.
And also, I think she was referring to the 15th or 2,500 inmates from Rikers that were released due to COVID concerns. That's another contribution to the spike in shootings that people were asking.
Well, the question is, and everybody gets defensive. NYPD blames this one, blames the DA. DAs blame NYPD. That's why you have to sort out what it is. But I know it's not bail reform because we went through that. Is bail reform? Okay, we came back, we reformed the bail reform. So it's not that. NYPD also suggested it was the chokehold law that we just signed. How could it be the chokehold law? It embodied the policy that was already in the NYPD policy. It just said it's a crime if you violate that policy. COVID release from Rikers, that's primarily done by New York City. So that would be the mayor. We may have released some from Rikers, but predominantly that's New York City. There was also a suggestion that the courts weren't processing people. I don't think that's correct either. So I don't believe those are the reasons for the shootings. And if it was the release of Rikers, you're trying to separate city policy from court policy from district attorneys, right? And who's responsible for what? That's what we have to figure out. You have the NYPD, you have the city government, you have district attorneys, and you have the courts. And there are a range of blame game going on, pointing fingers. The specifics I heard are the ones that I mentioned, and I don't think those specifics are accurate.
What do you think is the cause?
Before I give you my opinion, I want to make sure I have my facts, and that's what I'm going to be going through today.
Do you think there's been an environment of anti-police rhetoric? Do you feel as though that's a contributing factor at all?
Yeah, but how would it contribute is the question. Yes, there has been anti-police rhetoric. Yes. Fact. There has been anti-police rhetoric. Leading to what is the question? Leading to police being less aggressive, leading to what? That's what we have to find out. Okay, guys, thank you very much.
We stand with you with SPDR ETF liquidity leaders like DIA.
Good morning to all. Smiling, socially distanced faces. Beautiful day in New York City. Let's talk about where we are today, day 128. Everybody knows Melissa DeRosa to my right, Secretary to the Governor, Gareth Rhodes to my left, Deputy Superintendent, Special Counsel at Department of Financial Services, and he's been on working on COVID crisis for 128 days. Total number of hospitalizations, 817. That is the lowest number since March 18th, okay? So that is very good news. We have the 5-day results by region, and all the regions are performing well. You see a little blip up, a little blip down, day to day. That's That's really not of concern. You want to watch the rolling average, which is all good. Also, the numbers we get on Sunday are always a little bit skewed for some reason, but that's been going on since we started. You look within New York City. Again, you see the variance among different boroughs, but the numbers are all good, so that's good. Best news, a number of lives lost, and we're down to 9. It's unimaginable at one time that we would be this low. Obviously, you don't want to even see 9. You don't want 8, 7, 6, 5, 4, 3, 2, 1. But this is great, great news. The rolling average for number of lives lost is 9 yesterday. We did 54,000 tests yesterday. On average, we do about 60,000 tests per day. It's the highest testing rate in the nation. 0.95 positive. We normally run about 1.2, somewhere in that range. So that's all good. So what does this mean? What it means is
Hello, everyone.
She thinks it's cute that her driver almost hit my kids, and she thinks she needs to take a video of it.
I'm being threatened by a man in the ramble. Please send the cops immediately.
You want to call the police on him for having a barbecue on a Sunday at the lake.
Yes.
I just
All of these women have been identified as Karens by the internet. The term has burst into the scene as racial tensions reach a boiling point in the US. The phrase may be new, but Karen-like behavior has been a constant in this country's history.
I don't care what you think I'm acting like.
None of these women are actually named Karen, but to many people, they embody a certain persona in American society. A white person who uses their status and power to threaten or humiliate people of color. Actress and comedian Amanda Seales has been outspoken about who exactly Karen is. Here's how she defined the term.
A Karen is a white woman whose oblivion of their privilege causes them to act in a way that is oppressive and oftentimes insane.
She is crazy.
You're crazy.
Absolutely crazy.
See?
Some might think that Karen is just a loud white woman asking for the manager, disrupting your customer service experience. But I'm here to tell you, Karen goes a lot deeper.
You need to leave. You're not a part of this. You need to leave. You're not a part of this. No.
A Karen is a white woman who is a descendant of those who came before her, who could scream and get a black man killed, who could point and get a black woman murdered.
The use of Karen has become much more serious as protests erupt around the world following the death of George Floyd. People with Karen-like behaviors have made national news within the past few years and continue to be exposed.
Please don't come close to me.
Sir, I'm asking you to stop recording me.
Please don't come close to me.
A white woman appears to call police, accusing a black man of threatening her after he asked her to put her dog on a leash.
This woman don't want to let a little girl sell some water.
A little girl was trying to sell bottled water so she could go to Disneyland. Now her story has exploded. That video of her neighbor calling the police, now viewed more than 1 million times.
Sexually assaulted by a child. Go home.
Teresa Klein accused a 9-year-old boy of sexual assault, and the store's surveillance video tells a different story.
clearly showing the boy's backpack accidentally brushed against Klein.
For me, these videos are very triggering. I think that there's a certain level of like, oh, ha, 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 they're annoying when you're just watching it. But when you're in that situation, it is not an annoyance. It is a disruption of your being.
Ma'am, can you just back up just a tad so I can talk to her? Thank you.
Sure. You know that as a person of color, specifically a Black person, you are the one who is going to be in the situation of having to prove your innocence.
Our nation's current unrest shows how these behaviors can be much more dangerous than we think. Unfairly policing people of color is embedded deep in America's history. Karen just happens to be the new name for it. Take the 1955 murder of Emmett Till, a 14-year-old Black boy who was lynched after being accused of flirting with a white woman in Mississippi. She admitted her claims were false decades later. So Karen isn't always just a woman who likes to speak to the manager. It's much deeper than that. There's a common thread throughout American history, with people of color being targeted for existing in traditionally white spaces, or for doing something most would describe as normal or harmless behavior. And we've seen over and over again that these types of altercations can lead to serious consequences for those targeted, sometimes even resulting in death.
Good afternoon. I am honored to be joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, another familiar face, State Epidemiologist, Dr. Christina Tan. Great to have you both here. The guy to my left who needs no introduction, Superintendent of the State Police, Colonel Pat Callahan. Jared Maples, Director of Office of Homeland Security and Preparedness, is also with us, and we hope everybody had a good and safe 4th of July. Pat will give us a readout of what we saw around the state, not just in terms of COVID compliance, but also some general safety review of where we ended up over the weekend. Starting today, summer camp and educational programs for our youth have been green-lighted to reopen. Outdoor graduations may be held to celebrate the class of 2020, and NJ Transit returned to its full weekday schedule. We are continuing down our road back. However, today we are seeing a sign that we all need to take with the utmost seriousness and which we all need to work together to reverse. Today, the rate of transmission, the rate at which COVID-19 spreads from one person to another, exceeds 1.0 for the first time, I think, Judy, in 10 weeks. For the last 2 days, our rate of transmission, or RT, has been at 1.03. This means that for every new case of COVID we are seeing, that case is leading to at least one other new case. This means increasing rate of spread statewide. This is an early warning sign that, quite frankly, we need to do more. Over the weekend, we learned of several outbreaks across our state directly tied to travel to other COVID-19 hotspots nationwide. In Hoboken, of 13 new cases reported over the weekend, 12 are directly tied to travel to known hotspots. And I give a huge shout out to Mayor Ravi Bala and his team and the public health officials and contact tracers in Hoboken for their swift work to help stamp out this flare-up. And you can see Ravi's post there. And that's a heavy dose of a couple of things that we've been talking about every day, which is contact tracing that allows us to track this down and test. Elsewhere in North Jersey, several other new cases of coronavirus are tied to folks who traveled to a wedding in Myrtle Beach, South Carolina. We need to be smarter and we need to work harder. Our 14-day self-quarantine advisory for those who have come through a known coronavirus hotspot is there for a reason, to prevent flare-ups like the ones we are now seeing. So please go to covid19.nj.gov/travel to learn whether you should be self-quarantining. Our requirement that face coverings be worn while indoors and our need to wear them outside as well are there to help slow the spread of the virus. Millions of you literally are taking the need for self-responsibility to heart. But even so, just one selfish person can undo the hard work the rest of you all have done. I want us to be able to deliberately and responsibly continue down our road back. I do not want to have to hit another pause on our restart because a small number of New Jerseyans are being irresponsible and spreading COVID-19 while the rest of us continue to work hard to stop it. But we all need to be traveling down this road together. We all need to be wearing face coverings, even when it's a hot day like today. COVID-19 doesn't care about the weather. It only cares about finding another person to infect. Don't be a willing host. Wear a face covering, self-quarantine if you've been to a coronavirus hotspot, and get tested. This is how we reverse this upward trend of RT, or rate of transmission, and get it back down below 1. We absolutely must. We have, by the way, so many metrics falling in our favor. But with an increasing RT, all of that work becomes jeopardized as well. So with that, let's look at overnight. Yesterday, we received another 216 positive test results for a cumulative total of 173,611. The daily positivity rate was 2.14% for tests recorded on July 2. And Judy, for the past couple of days before that, it was 2.06, 2.48. So these are good numbers. That's a good data point, and we need to keep this number low because we know it also speaks to our ability to slow the rate of spread. Looking to our hospitals, the total number of residents hospitalized for COVID-19 yesterday was 861. Intensive care was 187. Ventilators in use 152. All three of those numbers decreased across the weekend. And as we look across the past 2 weeks on that right column, we see that the numbers in our hospitals have continued to steadily decrease. Here are how these daily numbers feed into the overall trends which speak to the readiness of our healthcare systems to be able to handle new cases. But as we measure ourselves against our peers, we see the need for continued vigilance. And they also speak to the need for us all to redouble our efforts on social distancing, especially on wearing face coverings that can further help slow the rate of transmission. And especially if you've not been tested and it is possible that you are an asymptomatic carrier of coronavirus. Today, we're reporting an additional 20 confirmed losses of lives from our New Jersey family from COVID-19. That brings the total of confirmed deaths to 13,373. The number of probable deaths increased by 2 to 1,856. As we do every day, let's remember 3 more of the New Jerseyans we have lost. We start today in Essex County to remember Timothy Lloyd Purnell, Sr. He was born in Virginia, but spent the past 59 years as part of our family in both East Orange and in Newark. He was a quintessential preacher's son who was also trained in the ministry and sang in the choir. But his future opened for him at Bell Labs. Brought on initially, this is an extraordinary career, folks. Brought on initially to serve as part of the groundskeeping crew, he soon moved indoors, first as a laboratory assistant, but eventually becoming a member of the technical staff, a post usually reserved for scientists with advanced degrees, most of them with PhDs. He was self-taught in organic chemistry, advanced mathematics, physics, and computer programming. He either authored or co-authored 30 journal and conference publications, and his work supported more than 15 patents. He was an advocate for Black employees at Bell Labs to ensure diversity in the future generations in science. All in all, he would spend 30 years at Bell Labs. Throughout his life, faith remained a guiding light, and he passed that love of faith to his children. He is survived by his 4 children, Kim, Allison, Bishop, and Chris, with whom I had the honor of speaking yesterday, and 7 grandchildren and a beloved grandniece. He is now reunited with his beloved wife, Marlene, and so many other members of his family. Timothy was 78 years old. May God bless and watch over him and his family. Next up, we remember Araceli Danilowitz. Sally, as she was known, was 73. Bless her. Born in Manila in the Philippines, she came to the United States in 1975 and settled in Passaic, where she would live for the rest of her life. Sally worked as a medical secretary in the radiology department of Passaic General Hospital for a quarter century, and after the hospital closed in 2003, she was a paraprofessional in the Passaic Public Schools, retiring in 2006. Sally was an active parishioner of St. Anthony of Padua Parish in Passaic and was either a member or founder of many social organizations across her community. She was an avid gardener, a fierce bingo competitor, and a great line dancer. She leaves behind her husband of 29 years, Mirik, and her children, her son Carlo and daughter Cecile, with whom I had the great honor of speaking yesterday, her son-in-law Carmine, and granddaughter Adriana. Like so many, Sally was blessed to have made her American dream come true. We are blessed that she did it as a member of our family. And again, may God bless and watch over her soul and her family. Finally today, we remember Clifton's Wallace Roney III, a musical prodigy from the age of 5 when he set free the first notes from his father's trumpet. He attended Philadelphia's Settlement Music School, where he studied trumpet and music theory. He continued his music education at Howard University before transferring to the Berklee School of Music in Boston. He found his way to New York, where he made his name performing alongside some of the greatest ever jazz musicians. Miles Davis himself was a mentor and collaborator. And after Miles' passing, Wallace was one of a select group which included such jazz luminaries as Ron Carter, Wayne Shorter, Herbie Hancock, and Tony Williams, who came together for a Grammy award-winning celebration of his music. That was by the way, one of Wallace's 3 Grammys, and he also contributed to the soundtracks of several movies, including Love, Jones. In 2015, he was named a UN Goodwill Ambassador to Senegal, where he brought instruments to schools in the village and introduced the students to jazz music. Wallace leaves behind his fiancée Dawn and his son Wallace Vernell Roney, a rising trumpeter on the New York jazz scene, and his daughter Barbara and stepdaughter Layla. He also leaves behind his grandmother Roselle, as well as his brother and writing partner, a star in his own right, saxophonist Antoine Roney, and his sister Crystal. Now, I mentioned he leaves behind his grandmother. His grandmother, according to Antoine, actually raised the boys. His grandmother lives in Los Angeles. She also lost a son to COVID-19. His grandmother, by the way, is 104 years old. We thank Wallace for his many years of music, and again, may God bless his memory, his soul, and watch over his family, including his grandmother. It is for them and for every New Jerseyan we have lost that we need to redouble our efforts to get our rate of transmission back down and to once again put ourselves in a place where the spread of COVID-19 is slowing dramatically. This thing is brutal, folks. You cannot take this for granted. Although he played at the Paper Mill Playhouse, he had no real Jersey roots, but you probably saw that actor Nick Cordero passed away yesterday at the age of 41. We just cannot, he battled that thing for months. I think he got sick in late March. This thing is brutal. And in some cases, it hits you and it passes and you never knew you had it. And in other cases, in our case, 15 or more thousand people, it crushes you. Yes, it crushes older folks more frequently. Yes, it crushes folks, as Judy reminds us, with comorbidities more frequently, but it takes out younger folks as well. We can never take anything for granted here. So please keep practicing your social distancing. If you've been traveling through a coronavirus hotspot, self-quarantine please for 14 days and go out and get tested. And most importantly, mask up. A face covering is what protects you from unknowingly spreading coronavirus for others. As I was out along our shore this past weekend, I saw many residents wearing a face covering while they were on the boardwalk and walking around, but I saw many others, many others, who were not showing the same courtesy to their fellow beachgoers. Let's all get on the same page. Face coverings are how we show others that we care about our communities. Face coverings are how we slow the spread of COVID-19. Face coverings are how we protect the public's health and save lives. This isn't about you. It isn't about politics. It isn't about how you think you look in the face covering. It's about us being able to continue down our road back as one New Jersey family. Let's lead the nation in this as we have done in so many other areas. Now, before I close, I'd like to highlight a small business that is able to stay open today because of the efforts we have put forward through the Economic Development Authority. Yesterday, I had the great privilege to speak with Michelle Files. And by the way, it turns out her in-laws are friends of the family and taught CCD to our kids. Michelle owns the bridal boutique, The Curvy Bride in Manalapan. The Curvy Bride in Manalapan. Michelle herself lives in Freehold with her family. Michelle left a career at a Fortune 500 company to pursue her dream and open the doors of the Curvy Bride in 2013, the first bridal shop in New Jersey that catered exclusively to plus-size brides. And she has won multiple awards and many thousands of fans in the years since. However, COVID-19 put everything on the line. Through the EDA small business support programs, Michelle was able to receive a loan to keep her 4 employees on the payroll, to pay her vendors, and to meet the rent. The Curvy Bride has not only survived, but today it is thriving. It's booming. Since reopening on June 15, when indoor retail resumed, Michelle has been just as busy, if not busier, than ever before. In fact, she told me business is so good right now, she expects being able to repay her loan early. That tells us so much about our business leaders. And Michelle and the Curvy Bride represent the tremendous spirit of New Jersey's small business community. They are, in every sense, the backbone of our state's economy. So to you, Michelle, and your employees, I am proud to see your success continue. I'm proud that we were able to help you keep your doors open for your employees and for your customers. And that is a good, positive note for us to close on. So before I turn things over to the woman who needs no introduction, I do want to give a shout out to Congressman and dear friend Bill Pascrell, who had some heart surgery over the weekend. Word has it he's doing great. So keep Congressman Bill Pascrell in your prayers. And Bill, you're a fighter unlike any I know. You stay strong, as I know you will, and can't wait to see you again soon back in action. Nobody fights harder or stronger on behalf of New Jersey than Congressman Bill Pascrell. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. As we see COVID-19 cases rise across the country, we are concerned about the impact to our state. As another example, in New Jersey, we had several confirmed cases and probable cases in the northern part of the state associated with a June wedding in Myrtle Beach, South Carolina. That's why it is critical that residents who have traveled to states with high COVID-19 activity and visitors from those states follow the recommended 14-day quarantine period. This can prevent the start of an outbreak in your local communities. If individuals need assistance in finding a safe place to quarantine, they should call the local health department in their area. Most of the counties have already identified locations where residents can stay during their quarantine period if needed. For example, Burlington County has contracted with 2 hotels, 4 rooms, so that healthcare workers, first responders, and local residents have a place available to separate them from their loved ones during a quarantine period. Neighboring Camden County also has hotel rooms available and has partnered with a local community-based organization to offer safe spaces to quarantine. In the city of Newark, the health department has contracted with a hotel that offers individuals who lack stable housing a safe place to stay and quarantine to lower the risk of transmission among this population. They are also collaborating with partners to provide wraparound services to help individuals find permanent housing. The East Orange Alternate Care Site has bed space set aside for individuals in quarantine who don't have shelter or need a higher level of medical care not available at their local quarantine sites. All health departments are equipped to support housing needs and assistance for residents while quarantining. Recognizing that some residents need a higher level of medical care not available in their local quarantine sites, the Department of Health has hired a medical quarantine director to assist with placing these individuals safely. We know it is an inconvenience to separate yourself from others and to stay home for 14 days, but it is vital to breaking the chain of transmission. State and local governments can assist you during quarantine. Please reach out if you need support. Again, you can call your local health department or NJ 211 to find assistance. Moving on to my daily report, as the governor shared, the hospitals reported 861 hospitalizations of COVID-19 positive patients and persons under investigation. There are 187 individuals in critical care, with 81% of those individuals on ventilators. Fortunately, we have no new cases to report of multisystem inflammatory syndrome in children, so the total remains at 51 cases in the state. The children affected have either tested positive for active COVID-19 infection or had antibody tests that were positive. In New Jersey, there are no deaths reported at this time. The ages of the children range from 1 to 18, and 9 children are currently hospitalized. The governor reviewed the new cases and deaths reported today. In terms of deaths, the breakdown by race and ethnicity is as follows: white 54.2, black 18.3, Hispanic 20.3, Asian 5.5, and other 1.8. At the state veterans' homes, 2 more residents have tested positive, for a total of 388 positive cases and 146 deaths of residents. At our state psychiatric hospitals, the numbers have remained the same. The daily percent positivity as of July 2nd in New Jersey is 2.14%. In the northern part of the state, it's 1.77%. In the central part of the state, 1.66%. In the southern part of the state, it is 5.38%. So that concludes my daily statistical report. Please continue to practice social distancing, wear a face covering, and wash your hands frequently for at least 20 seconds. Stay connected, stay safe, stay healthy, get tested. Thank you.
Judy, thank you for the readout, but also for your leadership day in and day out, and your team, Tina, and the rest of the team. You know, I think, I don't want to put words in your mouth, but I think it's fair to say that as we took the steps to reopen, we knew we were taking on some more risk. And that's probably a partial contributor to the increase in the rate of transmission, although the positivity rates remain very positive. But I think there's then this icing that's we weren't necessarily anticipating, and that's the explosions of this virus elsewhere in the country. Tina, does that make sense to you? And so you then get another increment that relates to the wedding in South Carolina, or the reality that Hoboken lived through. You and I were talking about Cape May, you know, and so we're now really, folks, we're dealing with both of those realities. And that's why, on the one hand, the steps we take that are incremental in reopening, it's really important that we take them responsibly, in a measured way, that there's a method to the strategy. And then separately, we can't say enough, I assume you all are in violent agreement with me on this. If you've been to a hot spot, you gotta self-quarantine. And you just have to, and you gotta get tested. And so those are sort of the two realities, I think it's fair to say. So thank you, as always. Pat, so we talked a lot about not just the regular compliance as it associates with COVID-19, which would love to get your readout as you give us every day, but also a sense of the 4th of July reality and the sort of safety report coming out of that. Again, thank you for everything.
Thank you, Governor. Good afternoon. With regards to EO compliance over the holiday weekend, there was basically 3 incidents. One, a gym owner in Linden was cited once again for remaining open. In Burlington City, state police responded to help clear a parking lot at a restaurant which had approximately 500 people, but beyond being outside, they were all actually also dancing and congregating inside, which, as we know, indoor dining is not yet reopened. And in Patterson, a similar situation where a restaurant and bar had several patrons inside the establishment, and that owner was cited. To the governor's point with regard to the weekend, I know I had mentioned public safety in Atlantic City. Most of you know there was a protest in an attempt to shut down the AC Expressway, but that was a generally peaceful protest. 6 people total were arrested there. With regard to fireworks, we had, sad to say, we had a reported death from a gentleman in Jersey City who got struck in the neck by a firework, and it killed him. We had 6 serious injuries from fireworks and 3 minor throughout the state. With regards to traffic, sadly, I report that we had 6 fatal motor vehicle crashes between Friday and Sunday. The state police alone made 74 driving while intoxicated arrests. And with regards to shootings from July 3rd to the 5th, there were 9 shooting incidents with a total of 10 victims. Also sad to tragically report that 3 of those victims succumbed to their injuries. But to end it on somewhat of a high note, if I can, it was a jet skier who had a malfunction with her jet ski down by Barnegat Light. Then her family put out a missing persons report, and our aviation troopers went up and found her by Clam Island in a broken down jet ski. She had been out there a few hours and actually hoisted her to safety and flew her over to the U.S. Coast Guard station at Barnegat Light, where she was reunited with her family. So that was certainly a positive story that I was glad to report that she was okay. Thanks, Gov.
Thanks, Pat. The contrary to the rumors, that was not Judy. But God bless the loss of lives. And folks, I'm all for dancing. That sort of stuff indoors, that can't happen. That can't happen. That's exactly why Arizona and Florida and Texas and other places are exploding, because they allowed congregation to happen indoors. We just can't. We're not there yet. I think we're going to start Ask One over with Dustin. I'm breaking a little bit of news here. We're going to go to beginning today, unless you hear otherwise. And sadly, given the world right now and the state of COVID in the country, we may shift courses, but we're going to go to a Monday, Wednesday, Friday schedule beginning today. So unless you hear otherwise, we'll do our best to keep it plus or minus at 1 o'clock each day, but we're going to begin that process today. So we will not be with you tomorrow. We'll be with you electronically. We'll have a virtual release, Mahan, I assume, each day, just as we have been doing on weekends. And unless you hear otherwise, we'll be with you at 1 o'clock on Wednesday. Thank you. Please.
Commissioner, you said last month that nearly all long-term care facilities had fulfilled the requirement that they test staff and residents by the end of May. Have you gotten 100% compliance on that? Are those results reflected on the Department of Health dashboard? And is the state going to require testing on a regular basis? Governor, on Meet the Press yesterday, you said you think there should be a national mask requirement, certainly when you're going out as well as indoors. Are you going to require people in New Jersey to wear face masks outside? And can you give more specific locations on the outbreaks? And then, did you know about or support your chief counsel's directive to the health commissioner to fire her inner circle in your office's attempt to find leaks? And what kind of message does that send to employees who may not be doing anything wrong but are still vulnerable to punishment?
Is that it? Judy, long-term care, did you hear that? So was your question, Dustin, where are we on testing in long-term care facilities, please?
Last month, she said, I think something like 98% had completed. So I just want to check back up on that, see if there's 100% compliance and whether that will be regular testing.
So I think this is us, by the way, not you, Dustin. Last month you had said 98% have been tested in long-term care.
Yeah, we have 100% baseline testing has been completed, and of residents and staff, and many, I don't have the number, but many are into retesting. The recommendation is to retest negatives and retest staff every week.
On masking, I think we were the first state, Matt Plotkin is with us, in America to mandate masking indoors, and I'm glad we did. And we're constantly assessing and reassessing the variety of the advisories and recommendations we have out there. We're looking at outside masking as we speak. So if we've got, I don't have any news for you today, but that is something, again, the virus, just to repeat a point we make all the time, the virus is a lot less lethal outdoors than it is indoors, but that does not mean it is not lethal. And it does not mean that you can't still spread it. And that's something I know that we're looking at. The outbreaks, I know Sussex County, Judy, was the family related to the wedding in Myrtle Beach, to the best of my... Sussex and Warren. And Hoboken, I don't know that we know the I personally don't know the hot spots for Hoboken, Dustin, but according to Mayor Bala and his team, 12 of the 13 were from hotspot states. Do you have any more color on the? Yeah, I've got nothing to add on who's working and who's not working, other than I don't know where we'd be without Judy, period, full stop, the best health commissioner in the country. Thank you. Brent.
Good afternoon, everyone. So what would it take to require masks outdoors? You mentioned coming from other states. Are most of these new cases coming from travelers from out of states? Are we seeing rises from beaches or protests or anything else? There are thousands of migrant workers from southern states picking blueberries in South Jersey now. They are not following the quarantine order, and their employees won't allow healthcare officials onto farms to test them. Shouldn't testing be mandatory as it is in nursing homes? And if not, why? Should a voter who is sick awaiting COVID-19 test results or is following your quarantine directive who did not receive their vote by mail ballot go to the polls and vote provisionally? And Commissioner Persichelli, have you said you would resign, and is the ongoing investigation into members of your staff making it difficult to do your job?
I'm going to continue to say I've got nothing to add on that.
Nothing to add.
I incorporate my prior answer by reference. What would it take, Brent? I think it's something what we're looking at real time on the masking outdoors. There is the obvious challenge that Judy and I and Pat as well have spoken to, which is you want to put something in place that you believe you've got a high likelihood of the ability to enforce. And this one is more challenging than some other, either you're indoors or you're outdoors. That's fairly easy to determine, but bear with us on masking. Again, I'm proud that we were the first state in America to mandate them indoors. I think it's a mix, Brent, in terms of the cases, in terms of a little bit after Judy gave her report today, I commented that we knew we were taking some amount of risk reopening, but there's a further element of risk associated with hotspots that is something that we weren't planning on a month ago. I don't know that we have an exact breakdown between the two. I'll have Judy come back and address the migrant workers in 1 second. I have to say this, if you're sick and you're awaiting a test, Judy, tell me where you are on this. As much as I want you to vote, I'm not wild about your going out into a public place. So I think what you should do is, if that's the case, get a hold of your county clerk literally the minute you're hearing these words come out of my mouth, and get their advice in your county as to what to do. Hopefully still be able to get a ballot. Remember, tomorrow's election day, and it has to be postmarked, as we've discussed here, at latest by tomorrow. And that's the advice I'd give. Judy, anything you want to add to that, but also on migrant workers and the testing protocols there?
Yeah, we have a task force working with the FQHCs in New Jersey to test the migrant workers. We have tested about 3,900, and we are working with the farmers to try to encourage testing in all of the sites. What we don't have is the exact number of migrant workers who are in New Jersey right now, because it ramps up. And we've got the blueberry migrant workers right now, but it will ramp up as the season goes on. So we're working with Department of Agriculture for those numbers.
Any different guidance on voting? Would you stay home?
If you're sick, don't go out.
Yeah.
You can't.
So get your county clerk, get a hold of them ASAP. And by the way, we talked about migrant workers. This now feels like 5 lifetimes ago, but Singapore thought they had this to zero, and then their seasonal workers came in. I guess there's not really seasons in Singapore, but it exploded. So I think anybody who's associated with that industry, and the ag industry is a big one for us, particularly in the South, is people need to realize it's in everyone's interest. It's not they're over there and we're over here. We're all in this together. So thank you for that.
And the workers themselves have been very cooperative.
Yeah.
The workers.
Great. Please, good afternoon.
Good afternoon, Governor. What is your level of concern about the non-cooperation with growers and their hesitance to have migrant workers tested on their farms? Do you support the recently proposed bill that would mandate such testing? What kind of mask requirement do you want to see on a national level, and how would it be enforced? The rate of transmission has been increasing more or less steadily ever since the state entered stage 2. Do you attribute that growth to any of the decisions in opening up to stage 2? And the rate is up, but the hospitalizations continue to drop. Is there anything to make of that? Thank you.
Thank you. The level of concern, I think we just addressed that among the growers and the seasonal workers. And it's something that it's one of the communities that from the get-go in terms of testing protocols, Judy's had in her top rung in terms of vulnerable communities. I won't comment on a particular bill, but if you're in a vulnerable community and one that we think is particularly exposed, our objective has been from moment one to test the entirety of that community. And so, again, putting aside what the bill looks like, that's an objective. Long-term care, our corrections communities, our seasonal workers, and so on. I think, bear with us on masking. Again, I'm proud of the fact, I'll repeat it again, that we were state number one to mandate them indoors. The virus is a lot less lethal outdoors. There's more mask wearing anecdotally than there was 2 weeks ago, but there's still not remotely enough outdoors. And that's something that we are, Judy and the rest of us are looking at this. You know, I think I've said this. I'll repeat it again and ask Judy or Tina how much of this is related to stage 2, how much of it is related to hotspots. I don't know that we know, but it's a combination. In the first part, we knew when we opened up the state again. We said this: we're taking on more risk, and that's going to lead to more transmission. But we felt it was responsible and manageable. I don't know that a month ago anyone would have anticipated that Florida would be printing 10 or 11,000 positives a day, or Texas, Arizona, parts of California, et cetera. So I think it's a mix. And how do we feel about rate of transmission going up, yet hospitalizations are going down? I've already spoken to the first piece, although Judy may want to weigh in. We're happy hospitalizations are going down. That's a good thing. But remember also, if you're a newly hospitalized person, it's a little bit of a lagging indicator. The rate of transmission is a here and now. The spot positivity is a here and now. The new hospitalizations is also a here and now, but it's from somebody who, in the most unlikely circumstances, didn't just get it yesterday and have the symptoms today that would warrant being hospitalized. It's a little bit of a lag, a modest lag. Anything you want to add to any of that? Tina, you good with that?
Again, we don't go crazy necessarily on the day-to-day numbers, perhaps going up or down, whether it's RT or other metrics that we take a look at. We also recognize too that even though the hospitalizations might look okay right now, we have to recognize that's also a lagging indicator as well. So again, we have to just keep on looking over time and continuing monitoring. But that said, it doesn't change what our responsibility is as far as taking that responsibility to still do the same public health management efforts with masking up, with keeping social distancing, with washing our hands. So again, we can't really control necessarily what might be coming in that we can't predict is going on. But at the same time, there are a lot of things that are within our control that we can actually take steps to do the best we can to minimize disease.
I would add one thing, and I'm not trying to make news here, other than we've beaten masking to death here, and we're going to be coming back on masking. I think one thing that this leads me to, Judy, is that we're not going to be jumping the gun on a whole lot more opening up steps right now, I would think, right? So we're at where we are now, and my guess is we're going to be there for a bit. If we see these numbers, particularly the RT, go down again precipitously, and the spot positivity rates stay down, that will allow us to take some steps that I don't think we feel comfortable taking today. And Tina made a very good point here. 1 or 2 days does not a trend make. So even when we define hotspot states, Judy and Tina and team are saying that it's data that's on a rolling 7-day average. And so, and particularly coming out of a holiday weekend, which may also distort numbers, et cetera. Thank you. Sir, do you got any?
Yep. Hang on one second.
I love your T-shirt, by the way.
Thank you.
You said before that weekends and holidays can throw off some of the numbers. Do you believe that the numbers that came out are lagging or indicators are suspect? How would a nationwide mask mandate happen, and should Congress be involved? And then the last question is, why have you not issued a mask mandate like the governors in Texas and Pennsylvania?
Yeah, I think we've beaten the mask point to a pulp here. Again, we are the first state in the nation to mandate masks indoors. We have a strong recommendation to wear them out of doors. We've said from the day one when we started talking about masking, we want to be able to enforce things that we mandate. But again, that's something we're looking at, and we'll come back to you on that. How would it work nationwide? I mean, you need. I said this yesterday in an interview. We are right now as a nation, and our job is focused on New Jersey, but we can't help but be concerned now with developments elsewhere in the country, because folks are coming back to New Jersey or visiting New Jersey. We're only as strong right now as a nation as the weakest link, and that's no way to run the Navy, as they say. We really need a national, some national parameters that everybody sticks to. And so I would think it can. I don't know that you need Congress for that. I'm not sure you need a law for that. But boy, we could really use that right now. In every state, no matter where you are in the nation, we expect the following parameters to be adhered to. Your first question was, are the numbers distorted or not from the weekend? I think we wait a few days potentially, right, Judy? I mean, the deaths. I hope this is right. The deaths have gone. The 4th of July, we reported 25 fatalities. The 5th, 23. Today, 20. I hope that's a trend. But why don't let's bear with us maybe till Wednesday, and with the benefit of seeing what we print tomorrow and Wednesday, what that looks like. Thank you. Mike, is that you? I can't see. You changed masks on me.
Good afternoon, Governor. Today, the Small Business Administration released the names of companies that got loans under the Paycheck Protection Program. One of the companies that you listed in 2019 on your financial disclosure, it's called Cohere Communications, got a loan. It's valued from $350,000 to $1 million. It reported that it would retain 21 jobs if it got the loan. I was just wondering if you could talk about what your role at Cohere is. It's unclear from the disclosure, and when did that begin? Can you confirm whether those 21 jobs were saved or not? And did you play any role in the firm getting the loan? And if so, what role did you play? Thank you.
I literally walking over here or coming over here, Dan Bryan called me up and said you had raised this with him. It's the first I heard it. I have an investment. I can't remember the last time I spoke with anybody associated with the company. I played no role whatsoever. But we'll come back and give you some more color if there is any beyond that. But as I said, the first I heard of it was indirectly from you. Thank you. Sir.
Oh, is it my turn again?
Mike's done.
Good afternoon,
I think
everybody.
Mike's done. Was that it, Mike? Okay.
Yeah. Good afternoon, everybody. Well, I was going to ask you a question, Phil Andrews from New Jersey News Network, about masks. But it seems like my colleagues have that pretty much covered. So let me move ahead to tomorrow. What are you going to be looking at as far as the primary is concerned, and what do you need to see from tomorrow's primary for your decision come the fall in November? What is it you're going to be looking at?
Is that it?
Yeah, I'm going to mask up now.
Mask up, exactly. I think the first point, good question, by the way, and again, remind everybody tomorrow's election day. Strong preference is if you've got a ballot to vote by mail and you postmark by tomorrow, means you get counted. Because it's a hybrid system, and again, the other side of this is we have mandated that each county have at least 50% of in-person capacity, and each municipality have at least one location. First part of my answer is we won't know a whole lot tomorrow, would be my guess. This is going to be something that I think will take some number of days to really give this the postmortem that it needs. But obviously we'll be looking at overall, we'll be looking at turnout. The more people, we're huge believers, is the more people who vote, the better, and that's a good sign that you've got democracy going in the right direction. So turnout will be a key fact that we'll be looking at. Secondly, I think we'll be looking, as we've discussed often here in answering questions, were there any obvious breakdowns in the system? Either that's physical, in-person voting breakdowns, or on the other hand, breakdowns in the vote by mail piece of this. And I would say on that list, as it always is, we're going to be watching very closely for any shenanigans that we hear about, any voter suppression, anybody who's trying to job the system. But it will, in fairness, I think, take some time to give a full accounting for how this worked. The good news is we have time in order to make the decisions that we'll need to make for the November election. But our premise begins and ends with the fact we want as many people as possible having the ability to vote. Thank you. Sir.
Thank you, Governor. Today we saw pictures of people not wearing masks while using NJ Transit. How is that enforced, and what happens if that trend continues? Will you have to cut capacity? And last week, in reversing that decision on indoor dining just 3 days before it was set to resume, many restaurants had already hired back staff and ordered food in anticipation of indoor dining. That left some restaurant owners out thousands of dollars. How can the state make it up to those businesses that have already been hit so hard by the virus?
I have not seen the pictures on NJ Transit, but if Mahan can get them or look at them, that does not make me happy. I assume it doesn't make you happy either. And so there's some amount of discretion given to the operators, and there is some amount of carve-outs, I think, where health does not allow it, I believe under the age of 2. But as a general matter, that's not a happy reality. We need folks, without question, to be masked up inside, and that includes NJ Transit. Listen, in a perfect world, we're not making decisions with only 3 days to go. Judy and her team and our folks were on intensively last weekend. We were looking with horror as cases began to explode in other states that we've mentioned. And the risk, and by the way, looking at why they were exploding. So someone asked this earlier, and I realized we never addressed this. Judy, I don't think we've got, or Tina, we have no evidence to repeat again that people going to the beach, going to a park, protesting peacefully, that's led to the increase in the rates of transmission. This is overwhelmingly, the experts will tell you, is an indoor reality. And so we then got to Monday morning and we were horrified by what we were seeing. And so we had to put the brakes on it. I have nothing but sympathy for the small business community generally, and particularly in hospitality, which has been crushed. We'll do everything we can. The EDA will do everything it can, but it's another opportunity to remind folks that we need direct federal cash assistance. And a very good use of that cash assistance would be to go directly to the small hospitality folks, including the folks who had hired the team back, who had bought the meat, whatever it might be. It gives us no joy to not to have done that. But the alternative, I just have to and by the way, we have been aggressive on outdoor dining, aggressive on signing laws to allow takeout alcohol, and other steps. So, we have worked as best we can with the industry, but, the alternative at that point was a fairly horrific potential to be indoors. Again, remember the combination of data points: indoor dining or indoor drinking. You're indoors, you've got a ventilation issue, you're in close proximity, you're sedentary, and by definition, you have to take this off in order to eat or drink. And that's a really bad set of data points. So we will do everything we can for the industry. We have nothing but sympathy. It's been a crushing reality for restaurants, particularly the mom and pop operators, which is overwhelmingly the case in our state. We'll do everything we can through the EDA, but we need to be able to borrow money. We need to be able to get federal cash assistance. We need to look at revenue raisers that have to be on the table. And part of a big reason, it's not the only reason, but a big reason, a big group that would be benefit from that would be the hospitality industry. With that and a theme of the day here, I will mask up and say again to Judy and Tina, thank you for everything. Pat, likewise, with you in prayer. Jared, Matt, Mahan, and team will be back again, unless you hear otherwise, Wednesday at 1 o'clock. And in the meantime, folks, please keep up the extraordinary work. If you've not been to a hot spot, keep doing what you've been doing. Social distance, wear a face covering, wash your hands, as Tina said, with soap and water. And if you don't feel well, don't go near other people. Get tested. We've got the testing capacity. Fire away. If you have been to a hot spot, we need you to self-quarantine. And the list of states, Judy, is on our website. We'll update that on a periodic basis. But if you've been to a state that is a hot spot, self-quarantine and get tested. Quarantine and test. We need you to do that, folks. And if we do all of the above, we'll get that rate of transmission back down. We'll keep the spot positivity rates low. Hospitalizations, please, Lord, low as well. And we'll fight our way through this. God bless you all. Thank you.
It's a new kind of summer, but it's still summer. Go. Seize it with Infinity Now. Service, test drives, purchase, and leasing that comes to you during the Infinity Summer Event.
This is NBC Nightly News with Jose Diaz-Balart.
Good evening. I'm Peter Alexander in tonight for Jose. On this Independence Day, the first since the global pandemic, health officials are urging Americans to scale back their holiday plans. With most 4th of July firework displays canceled, it's the number of coronavirus cases that's exploding, with fears this weekend could fuel an even greater surge. This was the scene at one of South Carolina's famed beaches just this afternoon, just packed. And among the hotspots, Florida and Texas, both setting new COVID case records today, with warnings that hospitals in parts of the country are running out of room. Our team has it covered from coast to coast, and we begin with NBC's Sam Brock.
On America's birthday, a celebration largely stripped of fireworks, speeches, and large gatherings.
I've seen it very low pace. I've never seen it like this before. It's very, very, almost kind of like a ghost town.
Tonight, Florida recording an astonishing 11,400 cases, smashing its single-day high and once again leading the nation.
This really has to be brought under control, and it hasn't been.
Miami-Dade's largest healthcare provider, Jackson Health, suspending elective surgeries this week and now requiring special arrangements for an ICU bed.
Is this July 4th a make or break weekend for this country in getting coronavirus under control?
I think every day is a make or break day in this country for getting coronavirus under control, but this one even more so because people want to go out, they want to socialize, they want to get together.
With the country easily eclipsing 50,000 cases a day since Thursday, and infections on the rise in nearly 40 states, red alerts everywhere. Beaches in other parts of the country remain open. From Myrtle Beach, South Carolina, to once hard-hit Coney Island and New Jersey Shore coastlines, now packed.
We all tested negative for COVID, so we're taking the right precautions and we're being smart.
A return to celebrating with plenty of caution.
Take it seriously. I mean, you're taking it back to your parents, your grandparents, your younger siblings that could potentially get it, and it could be very, very serious for them.
The situation seriously escalating in several surging states. Texas just breaking its record, 8,258 new cases, the highest single-day increase since the pandemic started. In Arizona, ICU capacity at an all-time high of 91%. Vaughn Hilliard is in Prescott.
Despite Arizona breaking records this week and no downturn in the spread of COVID in sight, 4th of July activities have largely gone on as planned here. Well, other communities across the country decided to cancel. Here in Prescott, there is no mask requirement, and very few folks are opting to wear them.
In California, concerning signs. As beaches close across nearly the entire state, the Bay Area copes with hospitalizations not seen since April, and the state's healthcare system hurting.
It's just a scary prospect to think that we could very easily overwhelm our hospitals.
A new normal as America tries to free itself from a new tyrant, the virus.
And Sam Brock joins us now. Sam, what are health officials you've been speaking to saying about cases among young adults and hospitalizations?
Peter, look, the median age of those testing positive right now in Florida is about 36 or 37 years old. Very similar to the trends we're seeing in Texas and California, also states that closed down their beaches ahead of the holiday. But even in this healthier demographic, Peter, if a small percentage of people need to be hospitalized in an expanding pool, that could overwhelm the healthcare system. Peter?
Sam Brock on the ground in Florida tonight. Sam, thanks so much. And President Trump tonight is hosting his own 4th of July festivities despite the pandemic. Thousands are expected here in Washington for a military flyover and fireworks. Another large gathering is Donald Trump Jr.'s girlfriend, a top Trump fundraiser, just tested positive for the virus. Here's Kelly O'Donnell.
The White House South Lawn hosting the largest event here since the pandemic. Frontline healthcare workers invited. Attempts at social distancing, while the White House says masks are not required. On the National Mall, crowds expected for fireworks despite public health objections from D.C.'s mayor. President Trump insisted on spectacle, starting with the show in the sky over Mount Rushmore Friday night. The nation's birthday is usually a unifying event, but President Trump was on the attack.
Angry mobs are trying to tear down statues of our founders, deface our most sacred memorials, and unleash a wave of violent crime in our cities.
Today, Joe Biden released a glossy video message acknowledging a blemished U.S. history.
We have a chance to rip the roots of systemic racism out of this country.
The president portrayed political opponents and their supporters as evil.
And we will not be intimidated by bad, evil people. It will not happen.
Before a packed, nearly maskless crowd, he only mentioned coronavirus to thank healthcare workers.
Working tirelessly to kill the virus. They're working hard.
COVID-19 reached the Trump inner circle. Campaign advisor Kimberly Guilfoyle, girlfriend of Don Trump Jr., tested positive and immediately left Mount Rushmore for a cross-country drive back east. On this holiday, the president casts himself as a defender of American values.
America's heroes are embedded in our hearts.
Planting his own flag of defiance. Kelly O'Donnell, NBC News, the White House.
Just in time for this holiday weekend, a dangerous mix of sweltering heat and storms is impacting much of the U.S. How long will it stick around? Dylan Dreyer has the forecast. Dylan?
Good evening, Peter. The heat is on, and it has been for quite some time now. Temperatures down the south are still looking to be in the 90s. It'll feel like it's even warmer than that. On Sunday, it's going to feel like it's 100 degrees in Jacksonville, Florida. Charlotte will feel like 92, 97 up in St. Louis is your feels like temperature tomorrow. And then going into Monday, highs stay in the mid to upper 90s. Detroit should hit 97 degrees, Pittsburgh 95. And look at this, no end in sight. Even up until Thursday, at least, high temperatures will still be in the mid to upper 90s, close to 100 degrees. When you factor in the humidity, it's going to be almost unbearable with your feels like temperature well above 100. Peter?
It's a new kind of summer, but it's still summer. Go. Seize it with Infinity Now. Service, test drives, purchase, and leasing that comes to you during the Infinity Summer Event.
Yeah, that's for sure. It's a hot one. Dylan, thank you. And as we celebrate America's birthday, across the pond, they are enjoying their own Independence Day of sorts. After months of restrictions in Britain, pubs are finally open. And Sarah Harmon is there.
The lines stretch down the block as